Jim, you just took your shirt off on live, whatever this is.
You're not recording now?
Okay, Jeff, I know you like to bet, right?
I do.
$100 that my sister is the first person to show up.
Oh, on this right here? Your sister follows you. She loves you so much.
Yep, every time.
All right, I'll bet you lunch. How's that in Florida?
You'll bet me lunch in Florida that my sister is the first person to show up.
Okay.
Look at that. There she is. Boom. You owe me lunch.
You guys must have worked together in collusion.
No, it's every time. But you want to know something funny? She lives in Rhode Island, so you two can speak fluent Eastonese.
Wow. That's wicked cool.
So we're at New Hampshire, are you?
I'm in Portsmouth, New Hampshire.
Portsmouth. Jen, how far are you from Portsmouth? She'll answer here in a second.
Yeah, we're about an hour and 45 minutes from Providence, Rhode Island.
Yeah, I don't know. She says wicked. We do have a purpose to this call. She just said not far. Jeff, you are the person that got me into the regenerative medicine space. I wouldn't refer to you as the grandfather of regenerative medicine, but
it's been a long, winding road. It has,
dude. It has been it's been a crazy road. Neither one of us started this whole thing, but we have a lot of clinical experience between the two of us.
Yeah.
And we've seen a lot of the rise and fall of a whole industry.
Yeah.
And the people that have fallen in this industry, it's because they haven't evolved.
Right.
And that's, thankfully I have friends like you that are smart enough to evolve, and I just follow your coattails. But
I follow other people's coattails. So
funny how that works, isn't it?
Yes.
I want to talk today a little about you and I are meeting in Florida here in 2 weeks. What are we doing down there?
When we first started regenerative medicine, we looked at maybe 4 years ago, we got into the stem cell biologic world, and we realized that, using stem cells worked very well, but what worked best was when the stem cells, if we could get to what they secrete, which are called exosomes. And there are lots of different characters in this play, meaning different labs around the country that do different things, different ways. But what I found Dr. Ian White about 3 years ago, and he has a PhD in stem cell therapy. He's worked at, education is out of Harvard and Dartmouth, and he just has that background. He's a really sharp guy, and he's in it for the science. There's about 4 or 5 docs, PhD level people around the country that are just totally in it, trying to advance the science. And he's the one that owns a company called Neobiosis. He's one of the owners, and he does all the work on the exosomes himself. So basically, they get them from amniotic fluid. An exosome is a microvesicle. It's basically RNA and protein. There's 300 billion of them per cc. So what they do is that's what your body secretes inside you to heal tissue. They target inflammation, and the exosomes, in this case, they're called cytosomes. Same name. It can be confusing, but when you inject these especially into a joint, very, very powerful at targeting inflammation secondary to degenerative change. So these aren't going to be used on somebody that maybe just tore a tendon or has a strain or a sprain in 4 to 6 months. It's people that really can't walk anymore. They can't use their shoulders, their necks and backs are just arthritic, like a lot of people in this country. So these are very, very powerful, and we're excited to be using this product. And this is not new to us. We've had over 1,000 patients use this exosomal product, and it works very well.
Yeah, we're not far behind you in the clinical application of what we're talking about. And a couple points that I want to make from what you said. This isn't for the people that just got injured last week. We have other therapies available to us that can, basically the way I put it is, with these therapies, we trick the body into healing, or we trick the body into thinking it's more injured than it actually is, and then your body overreacts and heals it faster than you normally should. And remind me, I should show you the picture of my stepdaughter's blister that we lasered.
Okay.
I mean, it was a debilitating blister on our foot for a runner. We had that thing cleared up in 5 days.
Yeah, it's amazing what you can do with these regenerative products and modalities. And
It's nuts.
our biggest struggle, though, and you know this as well as I do, is that people they don't know what to do. They go to their primary care, who then sends them to their orthopedist, whose model typically is to inject corticosteroids and pray that that helps. And when it doesn't, they start talking surgery. So
Right.
is like mine. We try to find whatever we can to keep people out of that process. And
Right.
I always say I'm not anti-cortisone. I'm anti doing it the second, third, fourth time.
Right.
Know that the outcome's not going to be good.
You know, I've seen, I don't know how many patients that I've seen that have gotten a steroid injection and ended up with diabetes because of that injection. And that's not to say that the injection caused the diabetes. It's more like the diabetes was building and building up underneath the surface. And when you get a cortisone injection, it does spike your blood sugar. And for some people, that's enough to push diabetes up past the surface. All of a sudden, it's a disease process.
Right.
So lifetime, your limitation lifetime, you should only have 3 steroid injections your entire life.
Wow. I never heard that, but that makes sense. I mean, my goal is to have none.
Right.
But you know, I get it. If you're really hurting and that's the advice you're given, get it.
Right. That's the advice you're given. That's the advice that insurance will pay for. And there are businesses that are built to profit just from that. So they will say you can have one, or your insurance company or Medicare or whoever will say you can have a steroid injection, every 6 months. You really need to be thinking about that.
Well, they know the outcome, right? And the
Right.
outcome of surgery, which is, again, that's part of their business model. And that's going to be obsolete. When we talk about regenerative medicine, I just saw a Wall Street Journal article. And again, that's media. We don't know what to trust nowadays, right? But it was a study done, I think, out of Harvard that said within 10 years, 1 out of 10 procedures of any kind in the United States will be a regenerative-based procedure. That's 10 years down the road.
10 years down the road, 1 out of 10. I got to write that down.
Yeah, that's super, super important to know. So, all these people there may be people that can't afford the exosomal therapy,
Right.
stem cell therapy. It's coming. It's coming. It really is. And I look at it like we're going to be on the forefront of that, because there's going to be a gap time frame where offices don't know how to use it. And we've already been using something very close.
And you and I have the companies that are coming up with this that are recruiting us to teach for them.
And it's the future, flat out. It's for sure the future.
Yeah, 100% it is. I still believe that. We've had even our own colleagues that have come and gone in this business because they didn't have that lasting power like you and I do. But I know you've got patients building up. I've got patients building up. But this is, in my opinion, the 4th generation of regenerative medicine, right? So we started with PRP. That was in the 1970s.
Yep.
Late 90s, early 2000s, we started using your own stem cells, which were limited by your age. Cost, and for some people, they are cost prohibitive because they are about twice what we're talking about to do those procedures. Then we got into the umbilical cord cells. And we used to think that these cells actually, these blank slate cells, that your body would signal them to become this new cartilage. Now we know that is not true. Right. It's the other way around. It's the stem cells that are signaling your body to produce that cartilage. And the 4th generation is here with these exosomes, where we are just taking that chemical messenger from the cell that's telling it what to do and how to grow. So, I'm not going to say it works for everybody, but I will say that since we started using just the exosomes, our results have been outstanding compared to even what they were with umbilical cord cells, and they were still outstanding back then.
I think what it comes down to, and we know this, the healthier the person that receives these, the better off they're going to do. And I have a guy downstairs right now that has referred half of the skiers in New Hampshire into our office. He owns a ski. It's a ski shop outside of a local ski area, and awesome. He had this done 2 years ago, and is about 90% better. And he wants to be 100% better. And he literally 2 years later, he's having it done again.
Sweet.
He's a very healthy, active guy. And when we have people that come in that aren't on 5 meds that bounce in here, that just have a degenerative joint, that's about a 95% success rate with those people. So
We're seeing the same.
and manage expectations, really.
Right. I remember, I'll never forget a lady that came in who had 85% of her knee function back, but she was mad that it wasn't 100. And clearly that's my fault, right? It's like, you're not going to have perfect joints after doing this, but it's the future. 10 years, according to the Wall Street Journal. You got to understand, though, what the future means. With the success rates that we're talking about, if everybody did this, instead of getting a joint replacement, you're going to cut 90% of joint replacements out.
Oh, yeah.
And that's going to piss a lot of people off that have a lot of power and a lot of financial means to fight what we're telling you.
Yes.
But I sure like it here being ahead of the curve rather than behind it.
Absolutely.
So I know you got people to get to, Jeff. I appreciate you jumping on with me for a few minutes.
Can you hear the knocking on my door? They've been knocking.
Yeah, they're already after you. I'm excited to see you here in a couple weeks. That's going to be awesome. But I need to get an East tour on the book so I can come to New Hampshire.
There we go.
And then visit my sister in Rhode Island. So, all right, bud.
All right, man. Thank you. Nice talking with you.
All right, we'll talk soon. Bye.